I'm studying molecular biology and really interested in disease prevention and medicine and the whole nine yards, but you can really only sit in a classroom for so long, and then after that you need some real-world experience.
Nearly 10 million people on the American continent are infected with a parasite called Trypanosoma cruzi. This parasite causes American trypanosomiasis, or Chagas disease. Trypanosoma cruzi is transmitted through the feces of an insect called the kissing bug. This bug feeds on the blood of mammals, including humans, and carries the parasite in its feces. When a person is bitten by the kissing bug, the bite begins to itch. When the person scratches, they accidentally rub the infected feces into the wound, and the infection spreads into the body. At first, the symptoms of Chagas disease are similar to the flu: fatigue, loss of appetite, body aches, and fever, and the symptoms disappear after a few weeks. However, the disease remains hidden in the body, and years later, more than a third of those infected will develop chronic Chagas disease, which damages the heart and often leads to sudden death. There is no vaccine for Chagas disease, and the treatment is only effective in the early stages of the infection. Therefore, prevention and early detection are the most effective ways to stop the spread of the disease. Basic education, insect control, and simple medical exams are all that are needed to save the lives of millions of people. Unfortunately, delivering such fundamentals to those who need it most can be difficult.
Well, it's just a very different experience being in a developing country, working in a clinic, where in 2 minutes we set up a clinic with, very little supplies and very little of anything that you would be accustomed to in the States, and you create this exam room with, plastic and whatever you find, and it's been really fun.
Access of healthcare in rural regions of Ecuador is made possible only through strong collaborative efforts. Researchers from Ohio University and the Catholic University of Ecuador collaborate with both the Ecuadorian Ministry of Health and with non-governmental agencies to detect and eliminate Chagas disease in remote villages.
From the diagnosis done by Ohio University, the houses in the most danger and with the most insects were identified. Thanks to PLAN and other sponsors, we were able to strengthen the infrastructure. It's important that institutions like this work together to help a population who really needs it and who are completely forgotten.
From 2005 to 2009, the Chagas Disease Research Project grew from 35 to 95 communities. The project coordinates 3 highly specialized areas into one coherent approach. The medical portion of the program aims to help the Ecuadorian Ministry of Health to diagnose and screen each and every child in a community for Chagas disease. In addition, ministry personnel are trained to pay special attention to pregnant women who may transmit the disease in utero to their unborn child. Simultaneously, epidemiological teams search for the kissing bug inside the homes of the village. If the bugs are found, they are captured for scientific analysis, and the house is immediately fumigated by a professional. The biological teams also search for the kissing bug out in the wild in order to study its natural habitat and identify possible ways that the insect enters a community. The third portion of the program centers around prevention. A variety of communication strategies are employed to raise community awareness of the disease and some simple ways to prevent infection.
There are many communities that don't even know what Chagas disease is, so we come with educational talks, booklets, and calendars to let people know how dangerous this disease is. With my help, it's possible to save many lives, so for me, this brings a lot of satisfaction.
Volunteers assist the project in all areas: medical, biological, epidemiological, and in community awareness. But an army of volunteers requires a strong support network and reams of materials to distribute week after week, month after month, year after year. Without a strong, well-funded support network, the battle against the disease would be impossible.
This program is really about people that really have absolutely no resources, and we're here to really help them through that.
Medical students often volunteer in the program. They gain experience through organizing community health clinics, assisting local doctors with assessment techniques, and conducting epidemiological research activities in the field.
It was hands-on fieldwork, and so that was really interesting to me. I guess it ties in the public health aspect of it. I know it ties in GIS and geography, which I'm getting interested in, and the biology of it too.
But volunteers are not just from the medical field. Statisticians, educators, media makers, geographers, and biologists all work hand in hand in this project. There's room for anyone who has an interest in making a difference in the lives of others.
Just being overseas is a whole different culture, a whole different atmosphere. Just you got a lot to learn.
The Chagas Disease Research Project continues its efforts year after year, slowly but surely defeating this affliction. But there is still work to be done. Communication strategies need to be tested. Various vectors of the disease needs to be tracked. New communities inspected and previous communities revisited. Volunteers trained and new ideas to be tried.
The community has always been open and always been willing to collaborate. I believe that is where all of the enthusiasm comes from. The youth want to participate in things that make a change in their lives, and that makes them want to learn.
We invite you to come and join us in the fight against Chagas disease. Whatever specialty you may have, wherever your interests may lie, there is a way to use them to help the people of Ecuador to help eradicate Chagas disease.
Participating in the tropical disease research allows students to learn about themselves. Because yes, you're gonna learn about the different culture. You're gonna learn about different techniques for field research, to use GPSs, the geographical information systems. You're gonna be working in the lab. You might be doing biohazard research or working with the entomological samples. But also, and most importantly, you're gonna allow you, the student, to learn about your inner self.